By Paige Winfield Kuhneman and Felicia Sonmez, Washington Post. Washington, President Donald Trump said his administration is taking immediate action to stop the global freeloading by foreign nations when it comes to the price that American patients are paying for prescription drugs. In a speech Thursday afternoon at the Department of Health and Human Services, Trump said his administration would be taking the revolutionary move of allowing Medicare to directly negotiate prices with drug companies who he says have rigged the system, causing U.S. patients to pay more for their medicines. Americans pay more so other countries can pay less. It's wrong. It's unfair, Trump said. The Centers for Medicare and Medicaid Services plans to experiment with a new way of setting prices for most drugs administered by doctors through Medicare's Part B program. Medicare pays the average sales price in the United States plus an extra fee based on a percentage of the drug's price. Under the new model, Medicare would pay doctors prices more closely aligned to the prices other countries pay. The new prices would be pegged to an international pricing index based on the average sales price in other countries with economies comparable to that of the United States. HHS estimates the new pricing index, which the agency says would apply to 50% of the country, would save Medicare $17.2 billion over 5 years. The administration says the approach will also eliminate incentives for doctors to prescribe more expensive drugs, since they would no longer be reimbursed for a percentage of a drug's cost but instead be paid a flat fee. It could also lower some of seniors' out-of-pocket costs, which are based on the total price paid by Medicare for a given drug. The announcement came hours after the Trump administration released a report Thursday morning highlighting the steep spending by the U.S. government on prescription drugs. It also comes less than 2 weeks from the midterm elections in which healthcare is playing a defining role. The report by HHS compares the prices paid by Medicare for 27 prescription drugs with the average prices paid for the same drugs by countries with similar economic conditions. It concludes that the higher U.S. prices means Medicare pays nearly twice as much as the program would pay for the same or similar drugs in other countries. Medicare could achieve significant savings if prices in the U.S. were similar to those of other large market-based economies, the report concludes. Thursday's address represents the next leg in the Trump administration's quest to appear tough on the pharmaceutical industry. The Medicare program, which covers 55 million elderly and disabled Americans, is responsible for 29% of the nation's prescription drug spending. In tweets Thursday morning, HHS Secretary Alex Azar referred to Trump's criticisms of other governments that pay significantly less for drugs than does the U.S. government. The United States is the biggest funder of research and development in the pharmaceutical sector, yet lacks the bargaining power to bring prices down, unlike in countries with public health care programs. The report provides troubling insight into how the current international drug pricing system has put America in last place, Azar tweeted. The president is focusing on healthcare in the run-up to the midterm elections in which Democrats have been hammering away at Republicans for their failed attempt last summer to repeal and replace the Affordable Care Act, a law which Trump has fiercely criticized. His administration has worked to chip away at several ACA requirements, and Democrats argue Republicans are not interested in protecting people with pre-existing health conditions and ensuring they receive health care at affordable costs. Trump has falsely tweeted that all Republicans support protecting people with pre-existing conditions. Republicans did not support the 2010 passage of the ACA, which enacted them, and the majority of them voted to repeal and replace Obamacare last year. Trump also signed sweeping legislation at the White House on Wednesday tackling the opioid crisis, although some experts say it is only a first step. The 19-page HHS report looks specifically at drugs purchased and dispensed by doctors themselves, under Medicare's Part B program. In the past, Azar has taken aim at that particular piece of the program since Part B spending has grown much faster than for drugs dispensed by pharmacies under Medicare's Part D program. While Part B spending on drugs has doubled since 2006, Part D spending on drugs has risen much more slowly. The report notes Part B is not subject to restrictions on the drugs that are covered, meaning there is little incentive to tamp down costs. Both protecting people with pre-existing conditions and bringing down prescription drug prices rank high among voters' concerns headed into the election. In a March Kaiser Family Foundation poll, 8 in 10 respondents said drug costs are unreasonable, and 92% said passing legislation to bring down the cost of prescription drugs should be a top or important priority. Trump kicked off his drug costs initiative last May from the White House Rose Garden, where he announced a 44-page blueprint containing some significant ideas that could threaten industries along the drug supply chain. The president in May also claimed drug companies would be announcing massive, voluntary price cuts. When Pfizer and Novartis announced over the summer they were pulling back on some planned price increases, Trump touted it as proof his pressure tactics were working. The administration has moved twice this month on provisions aimed at lowering drug prices. Trump signed a bill banning so-called gag clauses that prohibited pharmacists from telling patients when they could save money by paying cash or trying a lower-cost alternative medicine. Last week, Azar proposed a rule requiring companies to list in television ads the price for a 30-day supply or course of treatment for the drug they're trying to sell.